Hi guys, and welcome back to sqadia.com. Now, every time we see a hospital setting in the movies, we're usually shown an unconscious patient hooked up to a monitor that shows a continuous line beeping. Yes, I'm talking about the ECG. So what exactly is an ECG? It is an electrocardiograph, which is sometimes referred to as an EKG. In really simple terms, it is a visual representation of the electric activity through the heart. So in today's video, we're going to get into the super basics of ECGs. And we're going to talk about what a basic ECG looks like, the leads seen on an ECG, determining the heart rate using an ECG, determining the axis, and we'll also discuss some ECG intervals. So stick around till the end of this video. Taking a step back, let us remind ourselves how electric activity moves through the heart in normal conditions. First, the SA node in the right atrial free wall is the pacemaker. A pacemaker is what stimulates the heart contractility. What happens at the SA node is that it depolarizes, sending a wave of depolarization which spreads to the myocytes in the right and left atrium. If you'll recall, myocytes are the tiny cells in the heart tissue. Next, the depolarization funnels down and through the AV node and then goes down to the bundle of His and continues down the left and right bundle branches. And then all the way to the Purkinje fibers, which are embedded in the myocytes of the left and right ventricles. So when these Purkinje fibers depolarize, they lead to ventricular contraction. Alright, now that we've gone through the quick review of how the electric movement travels, let's move on to the ECGs. So this is what a normal ECG looks like. Now as a graph, the x-axis is the time and the y-axis represents the electrical activity. And as you can see, there are some positive and negative deflections. Positive deflections go upwards and negative ones go downwards. What's incredibly interesting is that each wave represents an ongoing event in the heart. Let's look at each of them. First, we have the P wave, and this represents atrial depolarization. PQ over here is the time taken from the AV node to the His bundle branches, and Purkinje fibers. The QRS complex is when the ventricles depolarize and generate the largest section. This includes a negative deflection, which is Q, then a positive deflection, which is R, and then a negative deflection again, which is S. And lastly, we have the T wave, which represents repolarization of the ventricles. So now we have the atrial depolarization, the ventricular depolarization, and the ventricular repolarization. Something seems amiss, right? Yep. It's the repolarization of the atriums, which is actually occurring at the same time as the QRS complex. And since the ventricular depolarization is such a large deflection, the atrial repolarization is embedded within the complex and does not show separately on an ECG. So that concludes our basic features of a typical ECG. To learn about the different leads and axes of an ECG, keep watching sqadia.com.